overdo it and tip into low blood sugars. But at the same time, you want to be meticulous. Get outside, get fresh air, get sunshine, not around other people. And you're going to have to take the same kind of precautions, people with chronic medical problems, as older people do. No one comes into your house who isn't essential. No one comes into your house who has any symptoms. No one comes into your house until they've hand sanitized. So what I talk about are contextually appropriate layers of protection. You have to add, like an onion, more and more layers of protection around you based on your medical condition. Can you give advice for those who own businesses? This is a really tough situation because you're really talking economics here, but the responsible thing to do is, if you are not in an essential business, I would urge you to think about closing down so that people cannot come in and mix and touch surfaces, etc. I know that's a bitter pill to swallow, and I'm not talking about pharmacies and grocery stores and things like that. But let's face it, shopping malls, clothing, let's close that down. Yes, it's going to hurt, but it's temporary. All right, I am going to try to add in my daughter now so that we can get your many, many mental health questions coming in. Let's see if we can do this. All right, it's saying that it's going to do that. You all are saying thank you to me, but let me thank you, especially the many of you who are, like all of us as healthcare workers, on the front line. So let me introduce my daughter, Caroline. She is a mental health professional. She's a certified trauma professional. I know she's been as busy as me because one of the things we're beginning to realize is that the kinds of precautions we've been talking about start to involve social isolation, and we're meant to be in community. So Caroline, let me have you take questions for about 10 or 12 minutes.
Hi, well, if you have questions, please be putting them in the comments as we've gone along. I've written down some of your questions. First and foremost, though, I want to share for those of you who might be really struggling and are at home struggling with suicidal thinking at all, whether that's passive or active thoughts, I want to remind you that that National Suicide Lifeline is available to you. You can pick up your phone and contact them. So again, you can Google that, but let me share that number quickly with you all. That is 1-800-273-8255. And again, that resource is available to you at home for free. So make sure that you reach out, as well as if you're in therapy and have a safety plan in place, make sure that you're following that safety plan. I also want to direct you to my Facebook page. That's just Poland and Associates. Just before going live, I posted a couple different resources, including a list of podcast suggestions that you and your kids at home can listen to, as well as using apps like Calm app and Headspace. So those are things that, because of technology, we have great access to at home, and I would encourage you to use those things. So one of the questions that I had previously gotten was, how can you control your anxiety and worry over the news, yet still stay informed? So one of the things that I have been talking to my clients about is that we don't want to be amygdala afraid, meaning in our fight or flight process, but we want to be well informed. So we need a good balance. And so we want to avoid choosing things that are either or, and instead choose things that are both and. So by all means, we want to stay engaged with the news, follow CDC guidelines, be engaged in some of that news process, but we don't want that to be all consuming. So one of the things that I've done is, every day I'll choose to watch some of the White House briefing or that top news, engage in some conversations with my dad about it, but I make sure to put good guidelines on that. So for the next 4 or 5 hours, I'm going to focus on going on a walk, reading for fun, doing some of my other work that I need to get done. Then I can go and check back in. The world isn't going to fall apart if I'm not following the news all the time. So we really want to set limits, and you are knowing yourself best of all. So know yourself, and when you start to feel a little overwhelmed, choose to set that aside for a little bit and set appropriate guidelines. Let's see. One of the other things that we can do, someone said, how can I navigate some of that fear and anxiety? Anxiety is rarely about the present moment. It's usually about something that has happened in the past, even if that was a minute ago, or something that's in the future. But usually in the here and now moment, we are fairly safe. And so I had just posted again a resource called Sensory Grounding. And that's something that can be really helpful. We are using our 5 senses. Even in a quarantine situation, we have all of our senses. And so being able to focus on what can I see, touch, hear, taste. I posted some guidelines for that, but being able to make some of those sensory bins for your kids is a fun activity. And when they're starting to feel a little anxious, you can teach them to take control over their anxiety as well. Go to your sensory bin and choose something that would be helpful. For nurses and medical professionals, again, this is a great way to kind of reset your nervous system in between some of those harder cases that you're seeing, which ultimately will help prevent compassion fatigue or burnout or secondary traumatic stress. Let's see, what else are we getting here? What do you recommend for teens to have social connections during this time? Right, so one of the things that I think is really important to understand is that social distancing is not the same as social isolation. So we are built to be in community, and our nervous systems are built to regulate off of one another. And so being really creative and proactive about the ways that we connect with each other is really important. That helps to reduce our anxiety. It helps to reduce some of those symptoms of depression. Remember that isolation is the fuel for depression. And so we want to be very proactive about engaging with that early on so that we don't sink too low with depression that we really can't have the energy to get ourselves out, or that we're so high with anxiety that we go into a panic attack. So be very creative. Again, we have really good resources for technology. You can go on and watch some Netflix shows with a friend, schedule some of those phone conversations with friends that maybe you haven't had time to talk to recently. You can set a coffee date with friends, or do a Google Hangout, something like that. For those of you who have access to a Kindle, or you can actually download the Kindle app and go into your library and check out books. You can read out loud with friends who are in a different location. So there's just a lot of really creative ways. My friends and I have downloaded an app so that we can actually play board games together at a distance. So I think there's a lot of really creative ways that you can go about doing some of that. My partner is not taking this seriously. It's very frustrating for me. I imagine that it is. It's hard when we are in a place where people who are living in the same place don't agree on the best way to navigate that. And so I think it's important to sit down and negotiate, just like you would with other things. What are our pandemic or quarantine rules, and come to a place of agreement on and what we would do. So just like many other areas, you're not going to perfectly agree on things, but can we write out some rules so that we can be at least in agreement on how to navigate that? I have created a set of cognitive styles in health decision making, and that might be something that you could go online and look at, because it's best to communicate in a way that he communicates about, and that's a much longer conversation. But if you're just trying to communicate from your perspective, that might not be the way that he's best understanding that. So again, if you want to have a further conversation on that, I would be happy to do that. Just send me a DM and we can go into that a little bit more. Let's see. Okay, another question is just navigating some of that sense of threat. So remember that our bodies perceive anything that is potentially impactful to our survival as a threat. And once we do that, we go into our fight or flight response. So one of the things that, and I've been in a kind of self-mandated quarantine for about 2 weeks, where I have only left to go to work and to go to the grocery store. But one of the things that I've noticed is that people have not been friendly and not smiling. So I went to the grocery store yesterday morning, and I thought it doesn't cost anything to smile, but as long as we're viewing each person that we pass as a threat, we're going to probably be a little bit more aggressive with them and hold them off at a distance. So let me encourage you, mental health wise, for yourself and for those that you're passing, it doesn't cost anything to smile and be nice. So just because we're 6 to 10 feet apart doesn't mean that we can't smile and wave. I thanked every person at the grocery store for what they were doing, waved at the person standing next to me in line and all that. So let me encourage you to smile as you walk past.
Caroline, I know there have been a lot of questions about young kids and how do you not scare them and yet educate? Are there any resources that would be helpful that you're aware of?
Sure. So if you go on to my YouTube channel, I just created that earlier this week, and I have a couple more videos that are going to go up in the next few days. But I actually posted one 2 days ago that included about 5 minutes of information on how best to talk to your kid about this. But what we really want to make sure of is that kids are hearing things, even if we're not engaged in conversation. They're overhearing the news. They're overhearing a comment that we might be making to a friend or partner. And then they're connecting things in ways that might not make sense because they don't have access to abstract thought or analytical thought. So we want to be very curious about what are you hearing, what are you understanding, and invite them to ask any questions that they have. So we really want to be on top of that with them so that we can catch some of those questions and fears that they might have. So we want to be very curious with our kids. But there's a whole YouTube video. So if you just search on YouTube Poland and Associates, there will be a video on there. You can also go to the Fred Rogers Center, and they've posted a great resource on how to talk to kids about their fears about coronavirus. Anything else? So make sure that you create a good schedule. Again, we don't want to be rigid. And I say with scheduling, we need to hold our schedules with open hands and be flexible instead of holding tightly. But humans thrive under rhythm and schedule. We like consistency. And so while all of our rhythm and consistency has been thrown off the last several weeks, creating some of that new rhythm for yourself will be really helpful. Again, we really thrive under some of that consistency. And so doing that will be very helpful. Again, you can follow me on Instagram at Poland and Associates and Facebook at Poland Associates. And then on YouTube, just search Poland and Associates, and I'll be putting up several resources a day that will help you to navigate your mental health during this time. But also feel free to send me a DM on Instagram, and I'll be happy to engage as much as possible on that.
Very good. Thank you, Caroline. I want to let people know again that we're not here to give individual medical or mental health advice. We want to give general overall advice, give you the best evidence, point you to the best resources. One of those is my own employer, the Mayo Clinic. I want to thank them for helping to support this. Please follow them. The best information that I know is available at Mayo Clinic. I also want to let you again know that if you're interested, we're going to have a call-in show on WCCO Radio tomorrow, Sunday, at 8 p.m. Eastern, 7 p.m. Central. The other thing is, if you'll send us a message to let us know what would be helpful to you, we can arrange a time for Caroline to get back on with us, maybe even do a whole show on this, because I'm getting these questions all the time, and I know something, but you know, that's not my training, the way it is for my daughter. And anyway, she thinks she knows a lot more than me since she was about 12, but I'm just teasing her. The other thing is we're considering doing a live Q&A for healthcare providers, because there can be conflicting information depending on where you live. And I would love to be able to get people from all over the world on this and give them the best information, almost like a grand rounds type setting where we can really go through things and take questions. But we're trying to help in the best way that we can. We don't get anything else out of this. This is our way of helping above and beyond the medical and mental health care we're providing to patients. We're here for you. Mayo Clinic has resources that are just superb. Caroline mentioned other resources on websites. All right, I'll take a couple of more questions since those have come up. I have mentioned in some of my videos about focusing on the things you can control. And Caroline, I'm going to ask, actually, let's do this one together. We've got a couple of minutes. Be thinking about what are the things that they can control in their life related to what is undoubtedly one of the most disruptive things as a society that's ever happened in our lifetimes. And I'll start with the medical ones. So the things you can control are who you're around, your hand hygiene, your what's called respiratory etiquette. So you cough into a tissue, throw it away and sanitize your hands, or into the crook of your elbow, or into your shirt. Anything like that decreases the risk of transmission. So it is social distancing, respiratory etiquette, isolation or quarantine, depending on your situation, and hand sanitizing. So Caroline, and then avoiding people who are ill, of course. Caroline, from the mental health perspective.
Sure. So again, I posted a YouTube video all about this on my YouTube channel, so you can get a lot more information there. This is a both and approach. So just focusing on the things that you can control doesn't mean that you can't still be sad and grieve the things that we've lost during this time. But what is it that we can control? We can control our thoughts and our feelings and our actions. So again, doing that sensory grounding piece that I talked about 10 minutes ago is a great way to control some of your feelings. I had posted on my Facebook page a thought record. You can just Google that. That's a really great way to go and change some of your thoughts and some of those thought processes that you have. And then your actions, the scheduling, some of the other pieces that I talked about before, the podcast that you listen to, the boundaries on what you're intaking in terms of the media. Those are great ways. But the categories that you really want to focus on are your thoughts, your feelings, and your actions.
Yeah, thank you. I might mention too that we know that people who watch a lot of TV and news under normal conditions, the more TV you watch, the greater the risk of anxiety and depression. So be careful with that. Well, we're going to end here. Blessings on all of you. Please be safe. Be careful. We will announce on this Instagram site probably early next week another set of these that we'll do. And thank you to all of my fellow mental health, healthcare workers for what you're doing. And for those of you that are not in that field, please stay in.